Assalamu alaikum, Miss Shahana. I belong to group number 31. My group members are Ariba Javed, Fiza Nazneen, Shabana Ehsan, Varisha Mahmood. The topic given to us for the presentations is Adverse Effects of Drugs on the Liver. My topic is Drug-Induced Liver Disease, made by Ariba Javed, roll number BP16500039, 4th Professional Year, Morning. Drug-induced liver disease. Drug-induced liver disease is a cause of acute and chronic liver disease caused by medications. The liver plays a central role in transforming and clearing chemicals and is susceptible to toxicity. The toxicity could be due to certain medicinal agents, chemical agents, laboratory agents, herbal remedies, etc. Chemicals that causes liver disease are called hepatotoxins. More than 900 drugs have been reported to cause liver disease. Drug-induced liver disease is responsible for 5% of all hospital admissions and 50% of all acute liver failures. Now I will discuss a case study. The case study says a 27-year-old African American male of body weight 42 kgs presented to the emergency department with a 3-day history of hypersomnolence, fatigue, and anorexia. The patient denied fever, chills, sweating, headaches, abdominal pain, nausea, or vomiting. He had a past medical history of asthma, chronic marijuana and tobacco use, bipolar disorders, schizoaffective disorders, and multiple suicidal attempts. His medications included haloperidol, benzotropine, aripiprazole, and was recently started on valproic acid, VPA. On admission, he had a temperature of 98.2 degree Fahrenheit, blood pressure of 117 by 82 mmHg, heart rate of 70 beats per minute, respiratory rate of 20 beats per minute. Initial laboratory results were remarkable for AST level. AST stands for aspartate aminotransferase level, that is 12,000 international units. ALT, alanine phosphate level, that is 7,000 international units per liter. ALP, that is alanine phosphate level, and that is 96 international units per liter. Total bilirubin count is 1.5 mg per dl, and serum ammonium count is 184 micromoles per liter. The patient also had thrombocytopenia and coagulopathy. Abdominal ultrasounds and computed topography of the head were both unremarkable. Viral hepatitis, serology, and acetoaminophen toxicity were both negative. Urine toxicology was positive for ethyl alcohol at 9 mg per dl, and ADR to VPA was suspected, and VPA was discontinued with the initiation of lactulose for hyperammonemia. On the second day after discontinuation of VPA, the valproic acid, his LFT started to trend downwards and his clinical symptoms of hyperammonemia improved. By the 8th day, his ALT, AST levels had dropped to 634 international units per liter and 61 international units per liter, respectively, and his total bilirubin was within the reference range at 0.8 mg per dl. A final diagnosis suggests that VPA causes drug-induced liver disease resulting in hepatic encephalopathy was made. Soap notes. Subject: age 27 years, gender male, weight 42 kgs, history. The patient has a 3-day history of hypersomnolence, fatigue, and anorexia. The past medical history of the patient is asthma, chronic marijuana, tobacco use, bipolar disorders, schizoaffective disorders, and multiple suicidal attempts. Medications. His medications included haloperidol, benzotropine, ariprazole, and was recently started on valproic acid, VPA. Object. Temperature was 98.2 degree Fahrenheit. Blood pressure is 117 by 82 mmHg. Heart rate 70 beats per minute. Respiratory rate 20 beats per minute. Laboratory results. AST level is 12,000 international units per liter. ALT level is 7,000 international units per liter. ALP level is 96 international units per liter. Total bilirubin is 1.5 mg per dl. Serum ammonium is 184 micromoles per liter. Assessment. According to patient's past medical history of bipolar disorder, schizoaffective disorder, and multiple suicidal attempts, his medications included haloperidol, benzotropine, ariprazole. These medicines help you to think more clearly, feel less nervous, and take part in everyday life. It also helps prevent suicide in people who are likely to harm themselves. It reduces aggression and the desire to hurt others. It can decrease negative thoughts and hallucinations. Valproate VPA drug interaction with other drug causes drug-induced liver disease, resulting in hepatic encephalopathy. The hepatic encephalopathy is when your liver is unable to remove toxins from your body and they build up in your body that makes it hard for your brain to work well. It can happen to people with chronic liver disease after an overdose of medications. Plan. Using valproic acid with any of the following medicines is usually not recommended, like haloperidol, benzotropine, ariprazole. Certain medications should not be used with alcohol, tobacco, since interaction may occur, and this interaction could be toxic as well. As the patient had a past medical history of chronic marijuana and tobacco use, so it caused toxic reactions with VPA, valproic acid. Liver problems may occur while you are using valproic acid, and some may be serious. So as the patient discontinued VPA, his LFT started to trend downwards and his clinical symptoms of hyperammonemia improved. By the 8th day, his ALT and AST levels had dropped to 634 international units per liter and 61 international units per liter respectively, and his total bilirubin count was within the reference range of 0.8 mg per dl. So when we stopped the valproic acid with these medications, so the patient started to recover. When we follow this plan, the patient recovered, and that is it. So the valproic acid was causing the toxicity in liver, and we discontinued this medication, and patient was stable. That is it. Jazakallah.